Thank you, Nell. Good evening, everyone. Good evening, everyone. Thank you. So, my name is Helga. I've been entrusted by my fellow co-founder, Simon, please wave, to tell you more about Afya Pamoja. Afya Pamoja is a Swahili phrase which means health together. And our vision is actually having the voices of the citizen at the heart of decision-making in health. So our mission right now, together with the government of Tanzania, is creating a platform that actually provides the solution in healthcare system with the voices in a digital platform. So by raise of hands, who likes receiving feedback? Nice, thank you. And who believes that feedback builds trust in the relationship? Nice. And who believes that it's important in improving the performance and accountability? It's a good crowd. Thank you. So most of us agree, which is very nice, but not everyone is comfortable with receiving feedback. Somebody told me a few days ago it's a necessary evil, feedback. And think of the healthcare system whereby the feedback is important to healthcare providers, and it can build trust around us, and there can be an improvement. And that's what we're trying to do. So imagine for a moment, we're all human beings. Sometimes we might need healthcare services. You're visiting a doctor or a nurse, and you're waiting for over 3 hours to see this doctor. And as you get to meet the doctor, there's no privacy to tell him or her what you really feel, because there are still other people outside listening to your conversation. And as you're trying to have the physical examination, the bed sheets are not clean. The window is actually open. And this is the real life of most of the people. So it's different because you're not able to speak more of the clinical setup of the disease, because that is more important to tell the doctor rather than the other areas. But it's very important for a person because they have to be comfortable, they have to feel safe. And this is what encourages more people to seek help in the healthcare facilities. And as healthcare provider, you want people to come, but people do not come to the health facilities because of such situations. And that's where we get to see the importance of feedback in the healthcare system. And it gets to be a vital tool because you get to have the people trust you and receive the services with dignity. And as a medical doctor and public health professional, I worked in public-private facilities. And in the last role I had, I worked in HIV/AIDS prevention program. And my role was making sure that people living with HIV come to receive the services, antiretroviral therapy. It's a continuous service. And the struggle was, how do I get the experiences? How do I present their struggles to the central system so that we improve the services, we make sure they come comfortably? And would get multiple feedback with some healthcare providers and healthcare managers, longer waiting time, experiencing stigma. I'm not bedridden, so I cannot wait 3 hours for a drug refill. So these were the things we were struggling and would solve per facility, per patient, per council, per region. And the struggle was, how best can we do it systematically and solve this? Because at a small level, you'd see the changes that you had, because these things you not think about it. So this is the problem we're trying to solve. In Tanzania, this is the box of feedback. It's written Sanduku la Maoni. And many such boxes exist in the hospitals. They might be outside the doctor's room. They might be hard to reach. But also sometimes trash is getting there. So, for the healthcare providers to do this, what would it look like for the citizens to easily provide feedback? And what would it look like if healthcare providers could access real-time insights on service of quality? And at Afya Pamoja, together with the government of Tanzania, received that we can improve the healthcare system in partnership by making sure that the patient feedback is part of decision making. And so what does it look like for the citizens who use our services? And our solution is actually replacing the boxes as well as the pen and paper with mobile phones. And in close partnership with the government, we have created some questions, SMS-based questions, which are actually in Swahili. They're very short, and the questions are actually requiring the experiences, like, did you provide consent before getting the physical examination? Was there water in the labor ward? And these such questions get to provide the experiences of people who use the services at the facility. And to date, we have scaled this platform in over 135 facilities in Tanzania, and we have received feedback from over 5,000 clients. And from these users that we have served, we have received the feedback that there has been an increase in trust to the services by 71%. And there have been an increase of 5% of mothers giving birth at the health facility. And this is a big win for us because there has been a high rate of maternal and child mortality rate in Tanzania because of not giving birth at the health facilities. I want to share some of the experiences. So last time I went to the facility, I had a chat with the mothers because we tried to have a conversation with the beneficiaries. And in this facility, there has been a renovation. The labor ward has been painted, and there has been a purchase of separators. And this mother is like, the government is listening to us. We are giving feedback, and this has happened to change. And what does it look like to the healthcare providers? They get to have large volume of data with the dashboards that can help them to make decisions. And these are the dashboards that actually also be guided in planning through the quality improvement teams. So far, we have measured there's an increase in by 94%, we have had quality improvement teams meeting, but also there has been a decrease by 75% of negative feedback on the quality of care from the users. Would like to thank the partners, starting with the government of Tanzania, 100X, and all others that you see on this platform that have made us do what we've been able to do. So we're planning in the next 2 years to scale up. Tanzania has a population of over 60 million people and over 7,000 health facilities. In the next 2 years, we want to scale up to 1,250 facilities and reach over 1 million citizens. And we want to show evidence that the feedback provides impact in healthcare. And we actually want to scale up in the other countries. And this is what we want to showcase, that we believe healthcare system strengthening can be very responsive and can also increase the quality of care in Tanzania. So we welcome you to join us in reaching out the 3.5 million, whereby right now we have raised half of it to make sure that we continue the mission that we have started. Thank you so much.